Hi, everybody. My name is Timothy Aaron Medina. My preferred name and pronoun is Tiame.
My name is Georgina, and my preferred pronoun is Gigi.
And I'm Carrie, and my preferred pronoun is she, her.
And we are the Water Health Nexus and Drinking Water in the United States group. The United States has failed in multiple instances to manage water in the present for future generations. From annual estimates stipulating deaths related to ingesting fecal matter from water are 7,000 cases across the United States. The CDC themselves said waterborne fatalities go unreported and unmonitored unless diagnosed by a hospital, because a centralized surveillance system monitoring these diseases related to water do not exist. Presently, public health officials in local and state regions have voluntary instructions to share data about waterborne illnesses and diseases with the Center for Disease Control and Protection, leaving communities in each state at multiple unknown health risks, and as the integrity of pure water continues to compromise. From a statement by the Environmental Working Group, it is estimated in 2018 the drinking water of up to 110 million of 327 million people across the country may be contaminated with a class of chemicals known to interrupt the endocrine system. These chemicals are found in several types of consumer products, such as carpets, clothing, fabrics for furniture, paper packaging for food, firefighting foam, and other materials such as cookware that are resistant to water, grease, or stains. Today, over 10,000 chemicals exist in commerce unregulated by the EPA. The chemicals used to treat these products can leach into the water supply during the production process, where they can stay for years. Exposure to chemical ingestion from water has proven to associate with long-term defects towards mothers of unborn children, causing congenital disabilities and lower IQs, as well as painstaking illnesses leading towards the death of other age groups too.
So where is this happening? We found a few studies that talked about issues with drinking water in the United States. The first map on the left is a study that assessed the number of water quality violations at the county level and found that violations happen mostly in rural areas and small communities where a lot of people rely on private wells and smaller community supply systems. And then the map on the right, which is from an ongoing study actually from the Environmental Working Group, shows tap water contaminated with PFAS, which is, it's also called the forever chemicals because they never go away, they accumulate. And they just released this database in which you can actually look it up online. It's an interactive map. And already they have identified 1,500 known locations with this contaminants. And now Carrie is going to talk more about a couple more studies we found.
Yeah, I like that Gigi chose these two images because they show that it's happening, that water contamination is happening in both rural areas and the bigger cities. I found the same information about what populations are vulnerable with a few different studies as well. There was a book that we all decided to read called Troubled Waters, and in that book it said that out of like a study from 2011 to 2015, excluding water violations from Native American reservations and US territories because they have been categorized historically as having more historical challenges in their water supply systems. But excluding those communities, 70% of the violations are happening in community water systems that serve less than 500 people. And Gigi also found a study, it was an environmental justice study, examining the public data set of violations. And what this research study looked at was they cross-tabulated the county data from a census community survey and then used the metrics with like an equity lens. So they looked at female-headed households, access to education, if the household had health insurance, if it was renter-occupied. And the conclusion was the same. One, that the violations are happening in communities that the water systems are serving less than 3,000 or 10,000 people. So a little bit bigger than the other study, but still smaller service systems. And that greater efforts are needed to ensure that the counties with higher proportions of minorities, uninsured households, and low-income households have access to safe drinking water. It's these communities that are often experiencing repeated drinking water violations.
So knowing that there are so many issues surrounding drinking water and chemical contaminants, we need to start talking about policy. And regulations surrounding drinking water in the United States, started from a concern about public health and contaminated water. So in 1912, the Public Health Service Act was expanded to investigate sewage and waterborne diseases, but it didn't go any further to impose water regulations, right? So as years passed, there were more concerns about the environmental and public health impacts of industrial discharge into waterways. So the Clean Water Act was introduced to control industrial discharge and to control discharge into navigable waters. And then years later, the Safe Drinking Water Act was introduced to protect public health. And it gave the EPA the power to regulate drinking water standards. And what this, looking at this history, what it made us think about was something that we learned from Lejano. So Lejano says that institutions must fit their context. And here we can see the different contexts not dominating water and drinking water over time in the US. So we're asking ourselves the question, where does drinking water belong? Is it an environmental issue or is it a public health issue?
So just looking at the two rules and amendments, I wanted to just look at the language of them. Language matters, navigable waters, and point source pollution. The second image is an administrative law called the National Pollutant Discharge Elimination System. It's a mouthful. It basically monitors pollutants from an identified point source into navigable waters. The reason why I bring this up is because if society expects for water to be free of harmful contaminants, the Clean Water Act would have stronger language around the idea of water. And we studied this a little bit with Linton, that the definition of water or concepts can change throughout the years. So according to the EPA, the definition of water is by the producers that are using it, and navigable waters is a transportation term. So reducing point source pollutants, that's a very low bar. We're regulating pollutants that producers are allowed to make in order to do business, instead of defining what clean water really, really is. And then the other point I would make is that if we think of the bottled water industry, the marketing is superb. There's beautiful, sharp, crisp pictures of icebergs, and it's clear that water is about health. But when you go to the EPA website, it's not so clear. And then even in well-researched books like Sedlick, Waters 4.0 that we read for this class, the consumer is asked to lend their voice and practices to reduce and manage water resources. But in reality, in our complex global world, businesses and economies are some of the driving factors of water use, and waste production really needs to be monitored better.
So going back to the Safe Drinking Water Act, we found that in our research, we found that many experts agree that the Safe Drinking Water Act has helped in improving drinking water in the US, but that one of the main issues is the high burden of proof needed to approve regulations. So the EPA is required to provide very complex economic analysis to make the case for approving regulations regarding chemical contaminants and water contaminants. And then on the other hand, you have the industries and the stakeholders who want to see the hard evidence that these chemicals are actually harmful to human health. But public health experts argue that it is difficult to provide this hard evidence because these studies rely on different models. There are too many different variables, and sometimes they need a long-term research. So the industry, namely the owners of manufacturing plants and people subject to regulation, and also, oh, I already said that, sorry. So experts argue that the Safe Drinking Water Act diminishes the EPA's ability to monitor drinking water violations and identify those communities and people who are at greater risk of suffering from poor water quality.
So this is just an example of a mixture of regional and regional level governance. So back to Linton as he talked about, describing things in ways that there are a different idea of what you would expect. The city of Toledo recently passed legislation that uses language to define water in relationship to its residents who drink it, and also the ecosystems that depend on it. So instead of restricting pollutants like the outdated EPA Clean Water Act, there's a Bill of Rights for Lake Erie, and it gives the lake the right to exist, flourish, and naturally evolve. And I thought it was a good example of something done well. In the bill, the lake is more than a lake. It's an ecosystem which millions of people and countless species depend on for health and drinking water and survival. And Linton had said that the idea of water has changed over time, but the idea of water being an essential part of our lives as well as other species is a really great start for us. Also, I think we can go to the next slide. Let's see. So I found a World Health Organization report that had identified clean water as a major health determinant. So what is a health determinant? A determinant is a condition in a place where people, live or work or learn, that affects a wide range of health risks and outcomes. So the WHO report on social determinants of health asserts that the lack of healthcare is not the cause of is not the major health determinant. Waterborne diseases are not caused by a lack of antibiotics, but by not having access to clean water is a bigger health determinant than both of those things.
So like Carrie mentioned earlier, we read this really great book called Troubled Water, and the author, Seth Siegel, had the following policy considerations that we thought were really interesting. So one of the main points he makes is that because there's a lot of infrastructure that needs upgrading across the United States, he sees this as an opportunity to take a technological leap and install smart sensors in the pipes that would allow us to monitor contaminants in the water in real time and make better decisions about what is going on with our water. And then he also makes the point that the EPA, that drinking water should be moved out of the EPA and moved into the Department of Health. And he makes the comment that we should amend the 1996 amendment and return drinking water to a public health focus. And then one of the last suggestions he makes towards the end of the book is that he really encourages people to know your surroundings and know your environment and know where your water comes from. And he makes the point that knowing your environment will help you know if there's something going on in your neighborhood that might be affecting your water quality. And we think that him and Lejano would probably agree that we have to reconcile our relationship with water in order to be able to rebuild policy and make better policy. And this is a quote that I took from his book that I think is really powerful. It says, "The use of drinking water is the only interaction that every American is guaranteed to have with the government every day." I think this quote really makes the point of how important drinking water policy is and how much we should really be paying attention to it. I think you're muted.
Implementing the water health nexus into the United States requires limiting discriminations from exercising its ability to segregate communities from access to quality water, a complicated, influential transboundary of itself. Therefore, we need chemicals regulated before reaching commerce. Malnourished water is a liability. Without standards restraining allocations of contaminated water, water security risks the health of existing and future generations. It is an unfortunate truth, but sick people are burdened to limited resources like time and money, meaning public health officials must form transparent alliances focused on minimizing consequences to ill health, regardless of background. For action-based solutions, a centralized surveillance system monitoring waterborne illness is critical. The Water Health Nexus is an opportunity for creating a fair, equitable system incorporating legal, policy, and regulatory framework for the rights of people accessing any resource. Contaminated water is no longer under the bridge.
And that is our presentation. Thank you, guys.
Thank you.
Okay, thank you guys. So I've got a couple questions maybe to get the conversation started. So Gigi, you posed a question early in your presentation asking whether water was an environmental issue or a public health issue. You guys basically throughout the presentation answered that question, but I'd like you or Carrie or Tiame to answer the question explicitly. What is water?
I had a definition.
It's a trick question.
Is it a trick question? I can't say like my interpretation.
Yeah, of course you can. Sure.
Okay. God, hold on. I remember writing it down.
Is it, Tiame, is it an environmental issue?
I think it's
It's what you think. It's what you believe. Yes or no? If you don't have to, don't feel guilty if you say no or say yes.
I don't think that is an environmental issue. And the reason why I don't think it's an environmental issue because I don't think that the environment chose to give us the contaminated water that we're drinking from our systems.
Okay. So we're not only focusing on contaminated water, though, we're focusing on water more generally.
Yeah,
Okay. How about, is it a public health issue?
I
I
think
think
so.
that drinking water is, or access to drinking water is, it's more a public health issue than it should be an environmental issue.
And it also depends on like what type of water we're considering.
Right. Right. And Gigi was right in specifying that we were talking about drinking water.
Drinking water,
Yeah, however, there is an important connection between the water that we drink and the environment where we get it from. But
Right.
I think that our policy would be stronger if we considered public health first before environmental impacts or before economical analysis or impacts of the regulations that we impose. Because ultimately, like, one of the biggest impacts of not managing drinking water well is going to be to our health.
Okay.
And
So,
also the way in which we manage our water and our drinking water systems also has an impact on other species and the health of the environment in general. So I think it should be seen more from a health perspective.
okay. Well, that was my second question then. What would the ramifications be if we move drinking water regulation out of EPA? You guys make a good point that EPA has an antiquated way of understanding water, and that their focus is more of a technical focus on water and what clean water constitutes. But if we go a step or two further, knowing what we know and focusing on what we've learned throughout the semester, that water is a social construction, it's what we make of it, and that our understanding of water is continually being remade and transformed. What would the ramifications be of moving it to health and human services, or Department of Health? What kind of complications might that generate? You just said that we have to take into account the environment, right? There are other factors and issues too that we need to consider beyond health, beyond the environment. Anyway, what do you think? That's to provoke you guys, to get you guys, and maybe some of the other folks in the class involved here in the conversation.
I think that question is just as hard as trying to remove people from what Navita and Joe and Grace were talking about, from communities that are in danger of flooding.
Water is
it would have very negative, it not necessarily very negative, but I understand that it would have major economic conflicts and economic interest conflicts with industries, and it would shift regulation perspective, and that would probably scare people. But I think the thing that we need to keep above water here is that public health should not be compromised under any circumstance, and the well-being of people. And I think the same goes for coastal communities. People's lives are important, and we need to protect people's lives.
So water is an interpersonal like relationship. No, and like Joe said, it's socially, the relationships are socially created. If we was to change water from the EPA to public health services, a ramification is the relationships that exist in public health services. How are they going to interact with each other and use water as a source to change society towards a direction where minority communities aren't exempt from something that is vital for them regardless of their background. So a ramification that water would cause is changes between relationships within any system or institution, and redefine goals. And that's really hard to redefine a goal when you have different perspectives.
Yeah. Okay. I think just one more comment, and we'll see if there are any observations from other folks in the class. Well, first of all, you guys did a really exemplary job of trying to connect your presentation and your paper with material that we covered throughout the semester. So kudos to you for doing that. That took a lot of effort, and that's something that I'm really pleased to see. You made a very strong case that the environment, or the Great Lakes, water itself, has its own rights, and that any system to monitor or regulate or engage with water should acknowledge the rights of water, the rights of the ecosystem as well. And I thought the example from Toledo was very provocative. The final thing was your discussion about communities and people. You made a very, very important point, but you kind of made it indirectly, that very often when it comes to water as a public health concern, or drinking water specifically, that communities and people are only conceptualized as consumers. For example, in the context of bottled water, there's very little consideration of people outside their role within the market, outside their role within their engagement with corporations through buying and selling. The notion that people might have other values, other priorities, that people might have a different way of understanding water, and that the value of water may not solely be as a commodity or a product to be consumed. So I think that's a really, really vital thing for us to keep in mind. Before we move on, we've got a minute or two here if there are any final questions or comments for Gigi, Carrie, and Yame.
I have a question for the group. Is the water health nexus something that's been theorized already, and has this policy recommendation been thrown around to transfer administration of water quality to a health agency?
I don't think so. I don't know, but I didn't find, well, when we were researching this, we didn't find any policy recommendation that exemplified this. The analysis we make about the water and health nexus was us just thinking about it.
It is a discussion.
Yeah.
Karen has something to share too.
I feel like we did talk about the Nexus approach a lot, like trying to understand what that meant, because like it's not, the Nexus approach would, so instead of maybe making water a part of the health agencies, maybe we just make it a priority for everything, since it's, you know, water isn't in relationship to everything. So maybe instead of like transferring it to the health agencies, we could just make it a priority for everything, for, you know, producers, agriculture, like they could just, everyone could put it in the forefront of their policy. That's kind of what I look at as a nexus approach, is like how water interweaves with almost everything. And the one exercise we did do was talk about like, what is healthy water? Like we were trying to figure out water filters for literally 2 or 3 weeks, and it just had more and more questions. And it's just it seems like a simple answer, like what's a good water filter, but it wasn't.
To follow up with your comment, Carrie, I did a paper a couple months ago focusing on climate, and I looked at different US federal agencies And you would be shocked to see the number of federal agencies in the United States that have the environment either directly or indirectly in their mission statements. And what that indicates is that there's a lot of turf conflict, right? That it's not just EPA regulating water. You've got the Department of Interior, for example. You've got NOAA involved with water resources. You've got the Army Corps of Engineers involved in water. So it becomes really complicated when you've got all these different agencies having to share responsibility for water, because they all conceptualize water in different ways. Not to mention the political turf, right, and battles that take place routinely. Going back to Corey's question about the water health nexus, most of the work that you'll find on water and health is going to be in the realm of the WASH agenda, the water, sanitation, and hygiene nexus. And that tends to focus on clean drinking water in the global south, where the types of problems related to access to clean drinking water tend to be of a different nature.